The Subcommittee on Homeland Security will come to order. As this hearing is being conducted virtually, we must address a few housekeeping matters. Members are responsible for muting and unmuting themselves. When you are recognized to speak, if I notice that you have not unmuted yourself, I will ask you if you would like the staff to unmute you. If you indicate approval by nodding, staff will unmute your microphone. To avoid inadvertent background noise, the chair or staff designated by the chair may mute participant microphones when they are not recognized to speak. We will be using the 5-minute clock, but if there is a technology issue during a member's speaking time, we will move to the next member until the issue is resolved, and you will retain the balance of your time. You will notice the clock on your screen showing your remaining time. At 1 minute remaining, the clock will turn yellow. At 30 seconds remaining, I will gently tap the gavel to remind the member speaking that their time is almost expired. When your time is expired, the clock will turn red and I will begin to recognize the next member. We will follow the speaking order set forth in the House rules, beginning with the chair and ranking member, followed by members present at the time the hearing is called to order in order of seniority, and we will alternate by party. Next, we will go to members who were not present when the hearing was called to order until every member present has had a first round. Finally, House rules require me to remind you that we have set up an email address to which members can submit information in writing at any of our hearings or markups. That email address has been provided in advance to your staffs. Now, with the business at hand, I welcome everyone to today's hearing, particularly our witnesses. One hearing will consist of 2 panels. The first panel will be with Bob Fenton, the Acting Administrator of the Federal Emergency Management Agency. Our second panel will include representatives from state and local emergency management agencies, whom I will introduce later. Today's hearing can be summed up in the answer to one question: what must emergency managers do to effectively respond to an emergency and pandemic? Since about the middle of the last century, we have called upon emergency managers when our nation faces a critical or complex humanitarian crisis, a natural disaster, power outages, pandemics, or the need for civil defense. These roles are codified in federal law, policy, and doctrine, such as the National Response Framework. A year ago, at the beginning of the COVID-19 pandemic, my staff and I asked FEMA what response role it would play. The expectation was that FEMA and its partners at all levels of government would play a large and visible role. However, inconsistent with FEMA's historical and statutory role, it was not given a role because the pandemic was seen by the previous administration as strictly a public health emergency and not an event requiring emergency management. The last administration's stance eventually changed as it became clear that responding to public health crises required emergency management expertise. The administration finally called on FEMA and its state, local, tribal, and territorial partners to help deploy hospital ships, get critical supplies into the United States, and to establish field hospitals and other operations for overwhelmed medical systems, including setting up testing and vaccination sites around the country. The intent of today's hearing is to look towards the future, using the valuable lessons learned during the pandemic to help us to better be prepared for the next emergency or disaster. Today's witnesses represent emergency management personnel at the local, state, and federal levels who are more than a year have worked tirelessly under difficult conditions to defeat the pandemic. We, the members of Congress, and our constituents are extremely grateful for your efforts. Please extend our most sincere gratitude to your colleagues across the country. I now turn to the distinguished gentleman from Tennessee, Ranking Member Fleischman, for his opening remarks.
Thank you, Madam Chair. It's a pleasure to be back to work with you and the committee's business this morning. I would like to welcome our new members, Ms. Underwood and Mrs. Hinson, to our subcommittee. I look forward to working with you and the veterans of this subcommittee on some of the hardest issues we face in government. Acting Administrator Fenton, welcome, and thank you for being here today. I'm a huge fan of former Administrator Gaynor. We worked well together. I know you and the chairwoman have worked together a lot in California, and I too am looking forward to working with you. This has been a year like no other. In fact, about 1 year ago today, it was that the committee moved to a virtual work format from home due to the COVID pandemic. And unfortunately, sir, FEMA's job was just getting started as the floods, tornadoes, fires, and hurricanes came on top of COVID. I offer my sincere gratitude to the people of FEMA who have been on the job in some of the worst of times. We saw FEMA teams in my own state responding after deadly and record-setting tornadoes, helping the COVID response coordination, and being there to help pick up the pieces after a bombing in downtown Nashville. Thank you to everyone at FEMA for their amazing work and cooperation with our states. To date, FEMA has obligated $63.8 billion from the Disaster Relief Fund in support of COVID efforts, in addition to hundreds of millions of dollars in grants to firefighters, emergency managers, and emergency food and shelter programs. I am hopeful that with successful vaccine programs, we will be able to turn the corner on this terrible pandemic. I will keep my opening statement short this morning as we have two panels, and I thank all of the witnesses in that regard. I thank you, and I look forward to your testimony. Madam Chair, I yield back. Thank you.
Thank you. Mr. Fenton, welcome to the subcommittee. I know you from your day job as the administrator for FEMA Region 9, which includes my home state of California. Since January, however, you have been the senior official performing the duties of the FEMA administrator. I look forward to hearing your perspective from your experiences in both roles. We will submit the full text of your official statement for the hearing record. Please begin your oral summary, which I would ask you keep to 5 minutes.
Thank you, and good morning, Chairwoman Roybal Allard, Ranking Member Fleischman, and members of the subcommittee. I appreciate the opportunity to be here today and discuss FEMA's role in response to the COVID-19 pandemic. This is an unprecedented challenge that has claimed the lives of over 540,000 of our neighbors, friends, family members across the country, and has caused grave damage to the global economy and put a spotlight on inequities through our nation. I began my career in FEMA 25 years ago as a reservist. From the first deployment in 1996 to my current role as the acting administrator, I have the honor of helping people across the country before, during, and after disasters. During my tenure, I have learned that FEMA and therefore the nation succeeds when our state partners are in the lead. Emergency management at its best is a coalition between federal, state, local, tribal, and territorial governments, the private sector and nonprofit sectors, faith-based organizations, and individual Americans. At FEMA, we are committed to ensuring that everyone has access to vaccination. This is our highest priority, and success is dependent upon the whole community being unified to achieve this goal. Our current work can be grouped into three broad categories in support of the President's strategy to respond to COVID-19 and ensure everyone is vaccinated. First, at the President's direction, FEMA is reimbursing 100% of the costs for Title 32 National Guard forces, as well as 100% of eligible emergency protective measures incurred by states, local, tribal, and territorial partners in response to COVID-19. This includes reimbursement for vaccination efforts, COVID-19 screening, and personal protective equipment. Further, on February 2nd, the President directed FEMA to make reimbursements for expenses incurred retroactive to the beginning of the disaster. Taken together, these measures represent a substantial increase in assistance to our partners. Second, FEMA is working to support state, local, tribal, and territory-led community vaccination centers, also known as CVCs, through the development and deployment of federal personnel, the provision of equipment, supplies, and technical assistance, and awarding of expedited financial assistance. Third, FEMA has teamed up with the Health and Human Services, the Department of Defense, and other agencies to establish state-led, federally supported community vaccine centers. These pilot sites are stood up in partnership with state and local authorities to better reach underserved and historically marginalized communities. These federally supported CVC sites come with an additional vaccine allotment that is above and beyond the normal state allocation and can administer up to 6,000 vaccines a day. As of March 14th, FEMA has obligated more than $4.42 billion for CVCs at 100% federal cost share. There has also been 834 federally supported vaccination sites, including 18 pilot community vaccine centers with 29 mobile units attached to them. As of March 14th, 107.1 million vaccine doses have been administered across the country, with nearly 90 million of those taking place since President Biden was inaugurated. Furthermore, the administration is able to provide states and territories with a 3-week vaccine supply allocation. As of now, this weekly allocation is up to 15.8 million doses, which is an 84% increase since the president took office. In everything we are doing, we are striving to ensure equity. President Biden has made it a cornerstone of this administration's efforts. And FEMA, we established a civil rights advisory group that is incorporated into all these activities. Since its inception in January, the Civil Rights Advisory Group has supported the development and the methodology used to determine CVC site selections, and also work with the 10 FEMA regions to collect and analyze demographic data, identify underserved communities, and collaborate with community-based organizations. FEMA is working with other federal agencies and our partners to ensure that vaccinations can proceed quickly as increased supplies allow, so that everyone who wants a vaccine can get one. Before I conclude, Madam Chairwoman, I'd be remiss if I didn't acknowledge the Herculean efforts of my friends and colleagues from our mutual home, the state of California. As you know, 2 initial pilot community vaccination centers were set up in Oakland, Los Angeles last month, and currently vaccinating 6,000 Californians at each site each day. We have a long way to go, especially with reaching underserved communities, but our success to date is due to the efforts of the men and women like Mark Gilladucci and the Director of the Governor's Office of Emergency Services, and Kevin McGowan, the Director of Los Angeles County of Emergency Services, and most of all, the people whom they lead. I know Mark and Kevin are appearing before your subcommittee later this morning alongside several other state and local emergency management professionals. And as I said in the beginning of my testimony, FEMA succeeds when the whole community succeeds. Professionals like Mark and Kevin make that possible. In closing, we greatly appreciate the subcommittee's steadfast support for FEMA's efforts throughout COVID-19 pandemic and for appropriating the resources our agency has needed to meet these historic mission requirements. Thank you for this opportunity to testify. I look forward to answering your questions today.
Okay, thank you. Before I begin questions, I would like to turn to the chairwoman of the full Appropriations Committee, Rosa DeLauro.
Thank you very much, Madam Chair. I will be brief. I know we want to get on to questions, and there's also a second panel. So I want to say a thank you to you and Ranking Member Fleischman for holding what is a very important hearing, and thank all of our witnesses for testifying. Since the Federal Emergency Management Agency's formation in 1979, the hardworking and dedicated FEMA staff have helped our nation prepare for, respond to, and recover from disasters and emergencies of all kinds. They have answered the call to serve, working under the most difficult circumstances and facing daunting logistical challenges to provide assistance and support those who are most in need. When our nation descended into the worst public health crisis in generations, the men and women of FEMA came rushing to the rescue. They have provided much needed medical supplies, personal protective equipment, and COVID-19 tests to our communities. They have set up field hospitals, testing and vaccination sites, put their own health and safety in jeopardy to help those in crisis. Though responding to this pandemic has not been easy for anyone, it would have been so much more difficult without the assistance and the support of FEMA. And now the agency is facing new and increasing challenges on multiple fronts, such as the growing potential crisis at the U.S.-Mexico border, where COVID-19 social distancing practices have increased the need for more beds, as the chairwoman of the committee knows. That is why it is more important than ever that we work to ensure the agency is properly equipped with the funding and the resources that it needs. I'm grateful that the American Rescue Plan provides $50 billion for disaster relief fund, as well as $510 million for FEMA's emergency food and shelter program, another $200 million for staffing for adequate fire and emergency response grants, as well as $100 million for assistance to firefighter grants and another $100 million for emergency management performance grants. But now that the money is getting out the door, we need to take a long-term look at the crises that FEMA will face in the future, understand how the agency can become more proactive to future challenges. And under the previous administration, FEMA had considerable difficulty responding in a timely and effective manner to the rising COVID-19 pandemic. That is why I and others wrote to Administrator Gaynor and others on several occasions to voice our concerns about the state of the strategic national stockpile and the need to increase the number of ventilators, N95 masks, surgical masks, and other medical supplies. Unfortunately, the response I received can only be described as inadequate, which is why I thank Chairwoman Roybal Allard, Ranking Member Fleischman again for holding this crucial hearing, and why I'm hopeful that under the Biden-Harris administration, we can move forward, incorporate the lessons we have learned from the pandemic, and comprehensively prepare for the future with the consultation with FEMA. With that, Madam Chair, I yield back.
Okay. Thank you. Mr. Fenton, through legislation and advocacy, many of my colleagues and I pushed the last administration to increase the federal cost share for FEMA public assistance for COVID and to broaden the scope of what was eligible for reimbursement. We were pleased when President Biden announced he would administratively make those changes. Can you explain how FEMA has implemented these changes with a particular focus on the expansion of reimbursement eligibility?
Yeah, so we've done two things so far. One, we've gone back and everything that happened prior to January 20th, the president made 100% so we could assist those with funding. And then going forward, we are now working with states and local governments to draft a policy that incorporates the expansion of our public assistance program to include assistance to help with school reopening, to help with transportation, to help with increased testing in other areas. So what we will do is work with them. We're about to publish the expanded policy. In addition to that, the new legislation also allows us to increase funeral benefits to additional people through the next year. So we're working on both of those, and hopefully the policy will be out with that. Right now, we focus on going 100% on the previous disaster and working with states and local governments to identify those costs and adjust our systems to calculate those new costs.
In HR 1391, the American Rescue Plan provides $50 billion for the Disaster Relief Fund. With that infusion of supplemental funding, do you think the DRF is sufficiently resourced through the end of the fiscal year?
Well, we have what we need right now to operate. We've provided $4 billion out already to vaccine centers. As schools start to reopen, we will get a better idea of the cost to reopen schools, to include providing protective equipment, supplies, and to provide testing. But also when we work with transportation, public transportation organizations, mass transit, on how we assist them. So we have enough to operate now. We project those costs to be sufficient through the end of the year, but we will communicate based on needs throughout the United States if that changes.
Okay. After the last administration refused to provide funeral assistance to families who suffered a loss due to COVID, Congress enacted legislation in December mandating FEMA to provide assistance at 100% federal cost share for pandemic deaths occurring before the end of last year. The American Rescue Plan continues this assistance into 2021. Could you please explain what specific assistance FEMA intends to provide, how it will be provided, and if the assistance is not yet reaching families, when can you expect it to begin?
Yeah, thank you for the question. Right now, our focus is empathy. When we talk about individuals that have lost loved ones, we want to make sure that we do it in an empathetic way. And while we've done funeral assistance in disasters, we've never done anything at this scale or scope. So the first thing we had to do is bring in additional resources to be able to meet the needs. The second thing we've done is done a lot of listening sessions with different organizations, funeral associations, and others, and then reach out to many different organizations to talk about culturally the unique needs for funerals, and to make sure that the policy we develop for this and how we assist it covers to the greatest need those that have lost loved ones. FEMA is on track to implement and start the funeral assistance program in early April. We are currently focused on training our call center staff and finalizing our policy. We will do this through a 1-800 number versus doing on an online registration. We think that, again, with empathy being the priority, we want to be able to case manage and have that human-to-human interaction as we do this. And make sure that we do it in a way that supports everyone's needs. So early April is when we look to start the program.
Okay. Mr. Fleischman.
Thank you again, Madam Chair and Director Fenton. I also want to welcome the full committee chair, Ms. DeLauro. Thank you for joining us today. I know you've got 12 subcommittees, and it means a lot that you're on with us today. Thank you. I mentioned in my opening statement the incredible challenges this year has been for FEMA employees. Not only did we have the natural disasters that battered our states, but FEMA had to roll out operations to support COVID declarations in every state, plus territories and tribes. On top of that, the personal stressors of the school-age children learning from home, or families struggling with job losses or illnesses have challenged almost everyone. My question to you, sir, is how is the morale at FEMA? How is your workforce holding up, sir?
I appreciate the question, Congressman. I get the opportunity to lead the greatest group of civil servants I know, with a great mission to be able to help people before, during, and after disaster. We have over 20,000 employees, about 20,000 employees of FEMA that have a wealth of disaster experience, and as you said, can be called upon on a moment's notice to deploy and help in disasters. Right now, about 75% of those that we send to disasters, there's roughly just under 14,000, are deployed right now to events across the country in response to COVID, the disasters from the Texas cold freeze that has happened, plus helping with the unaccompanied children issue and supporting HHS. We're doing well. I think our employees enjoy the work, quite frankly. I just got the Federal Employee Viewpoint Survey that shows a dramatic improvement with regard to morale, one of the highest increases in the last 10 years. I think when our employees are helping Americans, they're most satisfied. They get to do what they came to FEMA to do, and they enjoy doing that mission.
Yes, sir. A couple of other questions. I'll ask both of them because I want to make sure you have time to answer. Have you been able to avoid major COVID outbreaks despite the constant in-person work requirements? And then to follow this up, are you worried or concerned about an increase in employee attrition as we go into the next cycle of storms and weather that could impact FEMA's response capabilities, sir?
Yeah, so we take safety of our employees very seriously. We have taken a number of precautionary measures to do that. Like most of America, we've done a lot of stuff remote using Zoom and Teams and other chat functions to do that. But as you said, part of our business requires us to be in person. So we've done that in a way that we've made sure that people have the right protective equipment, that we do social distancing, that we do testing to limit the impact to our workforce, and have been pretty successful in doing that. In addition to that, we have started to vaccinate our workforce, especially those that are out at the community vaccine centers, assisting Americans through those sites. With regard to concern about attrition, since 2017, we brought on 3,000 employees at FEMA. And my experience is in these big events, whether it be the Katrinas, the 9/11s, the Sandys, the Marias, it is a great opportunity to bring on local hires. And we're hiring those right now at those community vaccine centers in the hundreds. And so as we do that, that'll be an opportunity for them to join our organization full time. And we usually see a big uptake after these big events of people that join FEMA because of being part of this mission.
Thank you, sir. In the interest of time, Madam Chair, I will yield back. Thank you.
Mr. Zorro.
Thank you very much. And thank you, Administrator. These questions come from Connecticut, and I'll ask them quickly and so that you can respond. You discussed the 100% cost share. Now, by the time President Biden took office, we were 10 months into the pandemic. My understanding is that some of the states had already used their Treasury coronavirus relief funds to cover the non-federal share of FEMA assistance. How will this work? Will these states be reimbursed? That's a question. Let me also ask you about, in the prior administration, FEMA issued the guidance that limited disinfection to facilities where eligible emergency work is performed, PPE to emergency protective activities. Can you tell us what the new policy will be for PPE, and when states and communities will see new written guidance? And just lastly, oftentimes it's hard to understand the roadmap seeking help from FEMA, that states and communities have to navigate what assistance is eligible. If you can talk very briefly about the right sequence of asking for that assistance, and can FEMA take on the task and direct us to the agency that will?
Yeah, appreciate the question, Congresswoman Rosa Valero. As far as, let me start with first the CARES Act. So they will be able to, states that went ahead and used their CARES Act funding for the 25% cost share, will be able to repurpose that funding and use it for something else. In fact, Treasury has extended the deadline to the end of 2021 to December 31st, 2021, to allow them to repurpose and use that funding, since now they won't have to use it for the cost share. As far as written guidance and the public assistance program, we're in the process of working with many different organizations to incorporate the president's direction going forward and increasing the public assistance program to help with vaccination, to help with opening schools, to help with transportation systems, and in other areas. And I suspect that those policies will be released very soon. In fact, one is going out today with regard to medical care facilities. So we will be putting those out hopefully in this month as we finish those sessions and incorporate comments from our stakeholders. With regard to the roadmap for asking for not only assistance through FEMA, but other federal agencies, there's a couple things that we're doing. One is we're making sure that, and we've had more new applicants than any disaster ever for our public assistance program, applicants that we normally don't service in disasters, especially for the medical community. So what we're doing is we've brought in a bunch of assistance from other federal agencies and private sector to help us expedite the processing. And we're working within our regions to states and locals to bring in long-term recovery functions and other federal authorities that are available to make sure that states understand the resources that are available to them, and that we partner together from a funding perspective and a roadmap perspective to fund what we can underneath our authority for the emergency protective measure, but so that we integrate that with other fundings like Department of Education and HHS and CDC to link those together so that they have a roadmap of what we will cover versus what is available through other federal agencies.
And you will be sending out guidelines with regard to that effort?
Yes, we will. And for example, in Region 9, where I'm from, we actually keep a document that's available on the internet to our state and local governments, where we put into those new funding resources and keep a compendium of what those all are, so that states could go in there and look for them. And then we try to specifically, if it's allocated by state, let them know what the balance is within those states as they're available.
Okay. Now, when you say repurpose, help me for a second. Are we going to reimburse the costs that the states incurred in those 10 months that the 25% match was still, so that's going to be reimbursed? I just want to be clear, because
Yes,
I know my state of Connecticut is going to be asking. I'm sure California is, and other states as well. And again, just to be clear, so it's a much broader range of disinfection, if you will, and protective services beyond where emergency work is being performed.
So going back, it's the policy that was in place going back, now at 100%. And so we'll pay all 100% of the costs going back. Going forward, the president's direction going forward, it allows for a more expansive public assistance program.
Fabulous. Thank you, Madam Chair. I yield back.
Mr. Rutherford.
Can you? Yeah, let me try.
Thank you, Madam Chair. Mr. Fenton, first let me say, as a 12-year sheriff and a 41-year law enforcement officer, I really appreciate all the work that FEMA has done for our state and local law enforcement and others in our response. I'm from Northwest Florida, Jacksonville, and I represent 3 coastal counties, and I can tell you, you all are a godsend for us, and so I pass that on to your folks. I really appreciate all y'all do, and forward to continue to work with you as your mission continues to grow, obviously. And so one of the questions that I have, Mr. Fenton, is we've now got, I think, 5 different packages, about $700 billion in discretionary money that has been, since the first, coronavirus preparedness response supplemental, the CARES Act, first came out. We wrote a letter recently to Mr. Fairweather, the acting director at OMB, asking where are how have these dollars been expended, that $700 billion? Can you tell us a little bit about how much of that money has been expended and how much is left?
Yeah, I could speak to FEMA's funding that we received so far. I can't speak to other federal agencies, but
Sure.
with regard to our funding, the majority of it has been provided to state and local governments through a number of programs, either our public assistance program or funding directly federal resources like the military or HHS to send doctors to hospitals, or funding masks for protective equipment. And so we've provided a significant amount of funding to do those kind of activities. Including that, we funded the program to help individuals with regard to lost wages and provide a significant amount of money on lost wages. Right now, prior to the supplemental that we received with $50 billion, we had about $10 billion left from the funding that has been provided to FEMA for our disaster relief fund to date.
I'm sorry, there's about 10 billion left now?
We have about $10 billion prior to the $50 billion that we just received from the current authority. I project that, as we go forward, that we will use funding for the funeral program, both going backwards, for those who have passed away and those who unfortunately will pass away going forwards. We will provide funding for more PPE and testing to open our schools. We'll provide funding for vaccinating Americans, the $4 billion we've already provided, plus there'll be more as we continue to vaccinate, especially as we expand that capability. So I anticipate between those and opening transportation corridors and getting America and the economy going back, we will heavily use our funding. Plus, as we all know, as we get to the summer, we'll be into hurricane and fire season, and we'll have our normal activity that we'll have to fund in addition to those things.
Let me ask you this, Mr. Fenton. Can you, and we may need to help you all with this, but I think one of the things that we need to look at is the processing time for these claims by state and local government takes so long that they accumulate huge amounts of interest. And so we're giving them millions of dollars, and then they're having to pay millions of dollars in interest. I think we ought to push to include that interest as part of their cost. If we're going to continue to drag this out in response to paying these bills, the state and local government shouldn't be held over the barrel for this interest. What do you think about that?
Well, all we can talk about is what we've had to do at FEMA, and we've tried to reimburse people as quick as possible. This is a unique event where we haven't had to do this type of work, especially with medical costs and new applicants, especially the number of nonprofits that have entered eligibility through our public assistance program. So this is unique, but what I would say is, for example, in the Community Vaccination Center program, which we put out $4.4 billion, that's less than 45 days. And one of the things we're doing is expediting that funding at 50% of the costs up front on projected costs, and then as bills come in, finalizing that. So I think there's a little bit of work to do on both sides as far as having ready bills, but also things we're doing to project the costs in front and give half of that up front to offset some of those immediate requirements so that we could work together to reimburse the final cost at the back end.
Thank you, Mr. Fenton. I think my time has expired. Madam Chair, I yield back.
Thank you.
Ms. Underwood.
Well, thank you, Madam Chair, and thank you for calling today's hearing on the ongoing pandemic response. During the first year of this pandemic, we all witnessed a colossal failure of leadership with fatal consequences. But in the past few months, we finally rounded a corner. With the passage of the American Rescue Plan, help is on the way. And after a year of grim milestones, including 500,000 dead, we finally have some new milestones we're celebrating, including over 100 million vaccine doses administered in the United States. These developments are promising, but we're not out of the woods yet. And one of the most important and logistically challenging steps on our path to normalcy is vaccination. We have a long road ahead before we reach herd immunity. And I'd like to ask a few questions about FEMA's role in helping us get there. Mr. Fenton, can you explain how FEMA plans to use funding from the American Rescue Plan to accelerate COVID vaccine rollout and get shots in arms?
Yeah, so we are doing a number of things to help with that. Why CDC and the operation are funding the vaccine supply, what we're doing is funding state and local government's capability to administer vaccine. So the $4.4 billion we've already provided out in the last 50 days is part of that. Second thing we're doing is we're sending federal personnel out there to help state and local governments. So actually people to administer vaccines. And to date, we've deployed roughly about 6,000 people out to help in that mission, whether it's Department of Defense, HHS, FEMA, the Forest Service, you name the federal agency, we have them lined up to help us in that mission, including DHS as a large is helping us out. And then lastly, what we're doing is setting up specific sites to provide large amounts of vaccine in large population areas where there's high social vulnerabilities to help to ensure equity and those most at risk are vaccinated.
Thank you. I'm hearing from my constituents every day that there's just not enough vaccine available in our community. I'm interested in seeing this change as quickly as possible. So I'm glad this administration has taken an all hands on deck approach. One component of FEMA's vaccine rollout support is the operation of mass vaccination sites, like the one at the United Center in Chicago. Mr. Fenton, what factors does FEMA consider and what stakeholders are consulted when selecting a site for a mass vaccination center like this one?
Well, we work very closely with CDC to look at their social vulnerability index score that looks at each county. And what we're looking at is a large population area. And if you take, for example, Illinois and Chicago specifically, we're looking at the number of people within the Chicago area, the social vulnerabilities there, but also recognizing that Black and Brown people have been impacted by COVID 3 times as much, hospitalized 2 times as much death, and to ensure that we're working with faith-based organizations, community-based organizations, and the state and local governments to target those areas and those individuals to ensure that we vaccinate them first. If you kind of look at the Illinois area, about 40% of the people that have been COVID positive and been hospitalized are from the Chicago area.
Right.
About 45% have died are from the Chicago area. So therefore, we're focused in on that area and trying to build relationships to the community to ensure that if there's any vaccine hesitancy, we get them vaccinated.
Well, as I'm sure you're aware, there was a lot of confusion surrounding the opening of the United Center vaccination site last week. The site was originally supposed to open for all Illinois residents, and then it was later restricted to Chicago residents only. State, county, and local officials in Illinois reported that this decision was made based on updated guidance from FEMA. Can you briefly explain to the committee what guidance you originally provided on eligibility for sites and what changed in your updated guidance?
Yeah, so in all 18 sites that we have open right now across the country, each one of them are focused only on that county. The state gets an allocation for the whole state, and we are focused just on the vulnerable populations within each county. What had happened in Illinois is the state started going ahead and accepting registrations for the whole state. The first 40,000 open, and 87% of them were white Caucasians, and it was not the focus and the intention of why we set up that site. The site was set up for social vulnerable populations within the Chicago area to help those that have been most at risk. And so what we did was we stopped taking registrations for that system, and we got everyone together and said, let's focus on the most socially vulnerable, the most at-risk populations, and let's come up with a way to go ahead and do that. The intent of that site has always been, in all 18 sites that we've set up specifically for that, are for those vulnerable populations, those people most at risk.
Well, listen, I'm a nurse. I co-founded the Black Maternal Health Caucus. I am very concerned about deadly disparities. Obviously, I'm focused on doing a work with an emphasis on equity. However, we need to be clear about who is eligible for vaccines appointments at the outset and the availability of those appointments. And we shouldn't have people facing unnecessary confusion as they try to get their families vaccinated. I certainly hope that we can work together to make sure that folks in my district, which is suburban and rural and elsewhere, have access to life-saving vaccines, including from FEMA-supported sites. Thank you, Madam Chair, and I yield back.
Ms. Henson.
Thank you, Madam Chair. Can you hear me okay?
Yes.
Okay, great. Thank you. And thank you, Mr. Fenton, for coming before us today to answer our questions and hear from us. In your testimony, you aptly discuss, of course, FEMA's roles in supporting our heroes, the National Guard, expanding vaccine access, and these are no doubt some very important parts of the work that you're doing. However, I am incredibly disappointed that Iowa has yet again been forgotten in all of this. There's no mention of the 2020 derecho that wiped out much of my district. Your testimony specifically states, operating in overlapping disaster environments creates additional challenges within already complex mission requirements. So in my mind, surely the massive weather event that devastated Iowa in the middle of a pandemic deserves your attention as well. The same farmers who were keeping our country fed and fueled, keeping our domestic supply chains operational during the height of the COVID-19 pandemic were severely harmed by the derecho. It was like a 1-2 punch for my district, and yet my constituents have had nothing but difficulty in getting FEMA's assistance. In particular, when they've, for example, asked for extensions for relief applications, they've been denied a simple extension by a bureaucrat in the middle of their lives being literally ripped apart. So it's incredibly insulting to the people in my district. It's insulting to Iowans that You'd come before us today and claim that the agency responded successfully to each of these natural disasters. You don't mention the derecho. This is after my team informed yours that I would be questioning you on that subject today. So for scale, NOAA's, the NOAA's official report, which, Madam Chairman, I would like to enter into the record,
So be it.
states that approximately an estimated 90% of structures in Cedar Rapids sustained some sort of damage from the storm, and more than 1,000 homes were destroyed. So it's in that report. And Iowans found themselves quarantined during this public health crisis with houses without power. They had holes in their roofs, no access to medicine or local pharmacies. It was terrible and is still terrible. And Iowans need support during this pandemic. They need it doubly so in the wake of the derecho. My district still needs serious assistance. And again, this is all on top of the strife brought by the pandemic, job losses, isolation, extreme mental health stress, and our kids included in that. And so now many families are having to deal with deciding whether or not they're going to put food on their family tables, removing hazardous trees, or repairing their roofs. So at this point, I see that to be completely unacceptable for my district. So my first question to you, Mr. Fenton, will you commit to me here today to stop forgetting Iowans and prioritize this relief for my constituents back in Iowa?
Yeah, thank you for that question, Congresswoman Hinson. And I think my testimony was focused at the time that I've been acting administrator of FEMA, which has been a short period. But I'm glad to get with you and your team and look into that event and look at what else assistance we could provide that we haven't provided. I know that we've provided about $47 million in individual assistance and public assistance so far there, plus significant more money from the COVID disaster that we've funded. But I'm glad to work with you and see what areas and what gaps may exist.
Well, I'm glad to hear that you're getting on board with prioritizing relief for Iowans. And the other thing I would ask you here today is, will you help commit to granting much needed extensions for Iowa's local governments on derecho relief applications? As I mentioned, this is a 1-2 punch, and we really need to make sure that they have the time necessary, compounded by the pandemic in the middle of a natural disaster. So will you commit to granting extensions for our local governments?
Yeah, I'm committed to work with you and all states that need assistance to disasters. We want to help everyone equitably. So I need to see what the issues are. I don't know specifically what grant application extensions you're talking about, but I'm glad right after this to work with you on those.
All right, our office will be following up, and thank you for, again, coming before us and the work that you are doing. I do want to note as well that many of the FEMA workers on the ground have done an incredible job. We talked a little bit about morale earlier, and they have done an incredible job on the ground. I think the frustration comes from when our constituents are looking to Washington for answers and they're not getting them from here. So I would ask you to commit to that, and thank you so much for your time, Mr. Fenton. Madam Chair, I yield back.
Thank you, ma'am.
Mr. Price.
Thank you, Madam Chair. I want to commend you and the committee leadership for hitting the ground running this session with some outstanding hearings, including this one. We do, I think, benefit from this kind of look across the whole DHS landscape, and so thank you for making this opportunity available. And thank you, Mr. Fenton, for appearing, for the work you're doing, picking up in a tough situation, carrying the work of FEMA forward. I speak as a representative from a state that knows FEMA all too well for many years past with disaster after disaster, and we do, of course, value the agency, and we also want to see the agency perform at full strength. So. This is a new challenge, and you've done a good job today lining out some of the ways you're dealing with it. A lot of news about the vaccination centers and the big push to get mass vaccinations done and to ensure equity and outreach with underserved populations in that process. Appreciate that perspective. Like other members, I've reached out to people in my state who are responsible for vaccinations and other healthcare functions, and finding some confusion and some uncertainty about what's going to change. I want to invite you to say whatever you want to say briefly for the record today about that, particularly with respect to hospitals. but we of course will welcome more explicit guidance as to what these providers can expect. I also want to ask you about the use of the FEMA Corps and what use you might make of the national service expansion, the AmeriCorps expansion that's in the pandemic relief bill. So those are my two subjects. If you could respond, the hospitals, of course, wonder what kind of reimbursement they're going to be subject to, vaccination efforts, other efforts. What is going to change for them? What's the reimbursement policy going to be going forward? Again, if you just briefly signal that. But then with the FEMA Corps and national service, you have these vaccination centers. You have lots of public outreach to do. You're going to need all hands on deck and then some. So I wonder what use the FEMA Corps might be in implementing this. This is a fairly recent innovation to have a branch of AmeriCorps devoted to disaster relief and recovery activities. And then we have in this bill a potential expansion of AmeriCorps, and we're exploring what kind of pandemic-related functions these new volunteers might perform. And I wonder if there's anything along those lines you have been thinking about.
Yeah, appreciate the question, Congressman. Let me start with reimbursement to hospitals. So for costs related to assisting those with COVID, whether it's expanding capacity or protective equipment that are uninsured costs, they could go ahead and submit those to FEMA for reimbursement if it's a eligible nonprofit hospital. Hospitals fall into a number of areas, so it would be eligible nonprofits. It would also be public hospitals that fall into those eligibility criteria would be able to submit those costs to FEMA for reimbursement. We will continue to expand and clarify our policy to help hospitals. We just provided an update today for hospitals to assist them with that. We've also brought in a number of individuals to help us with the insurance part, as medical insurance is very complex. And what we want to make sure is that we fund things that are not already covered by medical insurance. So we're working very closely and brought in a big team to help us get through those issues. And then with regard to FEMA Corps, AmeriCorps, I was actually one of the individuals when I worked in DC from 2009 to 15 that helped start FEMA Corps. And it's been not only a great effort to bring 18 to 24-year-olds in to start them in emergency management, but their ideas, their thoughts are invaluable. And so they've also gone not only from FEMA Corps, a large amount of them have actually gone into FEMA. And so it helps as a feeder also into our organization to create new employees for the future of FEMA that have service as part of their core values. So we'll continue to grow FEMA Corps. We leverage AmeriCorps already through agreements we have with them during disasters. Right now, we're using them at the vaccine centers to help register people, to help some of the logistics issues in line. But we use them all over the place, from people to do logistics, to do IT, to do GIS mapping. And so we've brought them in a number of areas through our organization to not only get them to help, but to help them with skills for the future as they go on in life.
Thank you very much.
Thank you, sir.
Mr. Palazzo. Then we will move on to Mr. Rupesberger.
Okay, I'm muted. Madam Chairman, first, thank you. And Mr. Fenton, I do want to acknowledge your mission and your presence today. FEMA is a unique operation that our country needs on a regular basis. We can't control a lot of the issues and storms that we face, but the most important thing is to have good people and have people that are prepared. There will be times when we're frustrated because of events that have occurred, and all the more reason why it's so important that federal, state, and local work together. Now, President Biden has set the goal of about 100 million doses of the COVID-19 vaccination in the first 100 days of his administration. Now, this is a tall task, and I'm glad to see FEMA is now taking an expanded role. You're going to make a difference. Now, Mr. Fenton, we were pleased when the president quickly reversed some policies of the previous administration, including expanding the scope of what is eligible for reimbursement for the COVID disaster declarations. Now, related to that, I have a question from a county in my home state of Maryland. And the question is the cost of contact tracing by state or local governments eligible under FEMA's policy? And if not, is there another federal agency who provides funds for the cost of contact tracing?
Let me go ahead and look at we're expanding our policy right now, and I don't want to, give you an answer that is incorrect. So let me take that for return and make sure I get that to you back with an answer.
Yeah, if you could do that sometime, maybe today, I'd appreciate
Yes.
it.
Yep.
So we can stay on top. There's a lot of issues going on. Okay,
Yep.
Secondly, we need to make sure vaccines are distributed equitably. We're facing some issues in Baltimore City. I applaud FEMA taking an active role in disaster response and establishing pilot community vaccination centers. Now, how does FEMA determine where to stand these up?
Yeah, well, first, let me just say that we have already funded, provided resources, equipment, or personnel to over 700 sites across the United States. And then when we talk about specifically the CVC sites, we've used population and literally walked down the population numbers from the largest population state and have set up 18 sites, and we'll continue to do that, working down population. As I said earlier, we use the social vulnerability index score for counties to drive where to focus those sites at. So we're looking for a high population area, about 1 million people for a type 1 site with a high social vulnerability index score of 0.7 or greater.
Well, then who determines where mobile vaccination centers are placed?
We do that in coordination with the state and local government and working with faith-based organizations and community-based organizations so that we focus in on equity. And one of the things that we've seen is by using mobile sites, people that have vaccine hesitancy are more willing to go to those sites than maybe the larger sites.
Now, we're appropriators for Homeland Security, have a lot of different missions. You have a lot of missions helping people, and we really need your help. We need to work together, as I said before, as a team. What would you like our committee to focus on as it relates to your mission in helping our citizens?
Well, you've provided us the resources that we need, but I think that just being in this business for 25 years, we continue to see the risk in our mission grow, as you've alluded to. And so we'll focus on programs that reduce risk, whether that's through our flood insurance program or through building resiliency, whether it's our mitigation program or our new BRIC program that focuses on hardening and making more resilient infrastructure, is really, I think, as we go forward into the future, is looking at that risk and how to lessen that risk and build smarter and build more resilient and go back and harden infrastructure that needs to be hardened.
You know, our president has focused and stated a goal on where he wants to be with our country, and it's a type of goal we need to move forward to save people's lives and to bring our country out of this terrible pandemic that we're in right now. Now, with that new strategy, it's putting a lot more pressure on you and your team. So it's important, in order to make your goal and the president's goal, that if it looks like you need more resources, you've got to let us know. I yield.
I appreciate it. We're well resourced, and that's my priority right now, is vaccinating every American.
Yield back.
I believe we have a little bit more time for a second round. Mr. Fenton, in addition to funding for disaster relief, the American Rescue Plan provides $510 million for the Emergency Food and Shelter Program, including $110 for humanitarian assistance to individuals and families released from DHS custody, $100 million for assistance to firefighter grants, $200 million for SAFER grants, and $100 million for emergency management performance grants. Can you tell us when FEMA expects those funds to be obligated and dispersed to grant recipients?
Yeah, right now we're working through the process. As far as the Emergency Food and Shelter Program, we are we have $4 million that's left over. That's not part of this appropriation that the NOFO is going out today. As far as the remaining $400 million plus $110 million specifically for the border, we're building the NOFOs for that in the next 30 days. Those will go out, and then the money will be provided in probably the next 60 to 90 days. As far as the other programs, we're looking at either leveraging the existing notice of funding opportunity that's out there and using that to incorporate the additional funding, or looking at whether we need to do something specific, and we'll work through each one of those to make quick decisions.
Okay. One final question. What lessons have you learned during this pandemic that will be useful in future disasters?
Well, I think we've learned a lot more about other federal agencies, authorities, and resources during this event. And we've also learned a lot about the missions need to be enduring, and we've learned a lot from technology and data from this event. The data we've been able to leverage in this event to make decisions and better make decisions has been invaluable. I give you one of the examples that we've learned from this event that's already improved what we do. Just like everyone else, we've been leveraging now Zoom and other mobile platforms to work remotely. We actually used those in Texas following the storm to do remote inspections of people's houses. So what took us 25 days before to get the first funds out, we were able to do in 5 days following the freeze down there by using a lot of remote platforms. So I think technology and other federal agencies' capabilities that we don't traditionally work with and their resources, we've learned a lot from that, and we'll be able to help Americans in future pandemics and also future disasters from that.
Mr. Fleischman.
Thank you, Madam Chair, Mr. Fenton, and to all of our members. This has been a very insightful and helpful hearing, so I appreciate round two. I read with interest in your testimony, sir, the information about mobile vaccination units. I think that's a great way to reach populations who are unable to get to a stationary vaccine site. I can't help but think about some DHS frontline employees who are still struggling to get vaccinated through their own state programs. I'm thinking of TSA officers, Border Patrol agents, customs officers, for example. I know DHS is trying to work with the Department of Veterans Affairs to get these public-facing employees vaccinated, but I'm wondering, is there a way that FEMA could help? Are you in a position, sir, to work with frontline DHS employees to help get them vaccinated in a timelier manner? Thank you.
Yeah, thank you for the question. And we are working with DHS. I sent one of my teams up to DHS to help them with vaccinating the whole DHS workforce. So they're working with the department and right now on doing that. Another thing that I did is if we opened up these 18 CVC sites, what we do is the first day before we open live, we bring through federal workforce and first responders. And so what I'm doing is vaccinating parts of the department. So I've vaccinated, for example, when I opened up the one in California, I vaccinated some people from TSA and other federal personnel, plus the personnel working there at that site. So I'm looking at opportunities to expedite the vaccinating of DHS employees. I've also written a letter that gives prioritization to all the FEMA employees to be able to use that to get vaccinated within the correct level within their state. So there's a number of mechanisms, including working with VA, we're doing.
Thank you, sir. As pilot community vaccination centers are being established in states, There is a requirement to distribute them in jurisdictions with high social vulnerability index scores, SVI scores. Did the federal government supply SVI? Did they apply SVI in determining vaccine allocations to the states, or was a simple per capita allocation used?
Yeah, the CDC, I believe, is using a simple per capita allocation in the state vaccination, in this vaccination we provided to states. So that's the over 15 million doses a week that's being provided. Plus, there's another couple million doses that are going to pharmacies across the United States, 10,000 pharmacies. In addition to that, we're vaccinating direct to skilled nursing facilities and elderly care facilities. And then the only place that I'm aware of that we're using the social vulnerability index score is the 18 sites that we've set up to focus specifically on the equity issue.
Would it be more cost effective, sir, and efficient to support state vaccination efforts by providing an increase in dose allocations and personnel to support their existing vaccination operations?
I'm sorry, can you say that one more time, sir?
Yes, sir. Would it be more cost effective and efficient to support state vaccination efforts by providing an increase in dose allocations and personnel support to their existing vaccination operations?
So I think what they're doing now is maximizing, General Perna and the operation and CDC are maximizing vaccine as it becomes available, using Defense Production Act and everything else to make it available, and providing that out to states and basically what they have available. And we've been able to give them a 3-week planning factor that will go no less than that number. And so that gives them confidence to be able to set up sites and to quickly vaccinate. I think as we go forward, continuing to use states' capability, whether it be doctors, pharmacies, state vaccine centers, will allow a sufficient throughput as vaccine increases, and it will only increase as we go into April and May.
Thank you, sir. Madam Chair, I yield back.
Mr. Rupesberger.
Yeah. What was the question? Yeah. Hello? Can you hear me now?
I can hear you, sir.
Okay. Yeah. Did you ask me a question? I didn't hear.
No, you're going to ask me the question, sir. I'll stand by.
Okay. Well, first thing, are we having another round? I might save the question for another round.
Yeah, you're in another round right now, sir.
The second round now. Okay. Getting shots in arms and crushing the virus requires a tremendous amount of coordination with countless stakeholders, and ultimately, county and municipal governments are where the rubber meets the road. Do you agree with that?
Yes, sir. Totally agree.
Okay. Now, my question for the entire panel are: what challenges are state emergency management agencies facing when communicating with local governments? Are there recommendations that we can relay to local officials in our districts regarding how to improve synergy from your perspective?
Yeah, I would just say that I don't believe that there's any issues with communication or coordination. We have now staff that work in every state emergency management office across the country from each regional office. So there's dedicated staff that are there 24/7 every day of the week, whether there's a disaster or not, working with them. We interact with our states and local governments through planning and operations in a bunch of different ways, and continue to do that. I think this is a dynamic and a complex event, and this has changed over time, and we need to be agile, and we need to stay in front of this event and be able to leverage state and local government, as you said, to the fullest extent possible to get shots in arms. They are most connected to the populations they serve, and we need to be able to support them in that.
Okay, thank you. Yield back.
Hey, sir, one last thing. I did get an answer. HHS can fund the contact tracing. FEMA funds cannot be used for contact tracing because it's an HHS's authority.
So any recommendations where to go?
Yeah, I'm going to go ahead and give you that to your team of specifically what part of HHS can fund that. I'll send that to your team.
Okay, thank you for that.
Yep.
Go back.
Mr. Rutherford.
Thank you, Madam Chair. Mr. Fenton, in Florida, the second most populous state in the country now, we've made some pretty great progress in our vaccine distribution under the great leadership of Governor Ron DeSantis. And so far, in fact, over 4 million Floridians have received at least one dose, including 60% of our seniors over the age of 65. And that is significant in, as you know, in the mortality rates. In Northeast Florida, we have a FEMA-supported vaccine site at Gateway Mall. This site has helped vaccinate residents who are 60 years up, long-term care facility staff and residents, the medically vulnerable, those you mentioned earlier, as well as teachers and first responders. You mentioned in your statement that these sites have a capacity for 6,000 vaccines a day above and beyond the state allocation. Is that correct? Did I hear that right?
Yeah, so what we did is when we went around and looked at each state and the population of the county, we adjusted the site to meet the need of those that are socially vulnerable. And in Florida, rather than do 2 type 1, which is 6,000 a day, they elected for 4 type 2 and did Tampa, Jackson, Miami-Dade, and Tampa. So they each do 3,000 a day. Plus they did mobiles from there. So like a spoke and hub concept. And I think each one has 2 mobiles that are going out to community-based organizations and targeting specific populations at risk.
Okay, so can you tell me for the site at Gateway Mall, what is their target?
Their target is 3,000 per day. That's the one in. Is that the one in Hillsborough? Is that what that is?
Jacksonville.
Jacksonville. So I'll have to look and see if that's one of ours or not. I'm looking at my list of the 4 that I have, and it's Orange, Miami-Dade, Hillsborough, and Duval are the 4 counties. Oh, Duval.
Yeah,
so,
it'll be Duval. That's Jackson.
Yeah. Okay. So the requirement is it's supposed to be 3,000 a day, and they also have a number of mobile sites going there. It looks like yesterday they did. I don't have the numbers from yesterday, but it's supposed to be 3,000 a day. They did 1,000 at the mobile sites yesterday. I know that.
Okay. What's the average distribution been of that 3,000 a day?
The average distribution?
Yes. They're allocated 3,000. How many are they actually getting into arms every day?
Yeah, I'll get you the specific numbers. I do. It looks like Duval is a little bit less than the other couple in the state of Florida, so it is a little less. But I'll get the numbers and get them over your staff.
Yeah, I'm a little concerned about how we're getting that information out to who's eligible. Let me jump real quick to the border, because we have a humanitarian mess at the border, which is why FEMA is being sent down there. And this administration has got to step up and start addressing this. And I guess they are by sending FEMA. Last month alone, we had over 100,000 people try to cross the border, and 9,500 of those were unaccompanied minors. So my question is, what's being done to test immigrants or migrants to isolate those with COVID-19? I know this has got to be a massive challenge for you guys.
Yeah, so in all 4 states that are along the border, and for that matter, anywhere in the United States, anyone that is at risk can be tested by local or state government, and FEMA will reimburse those costs 100%. In some cases, we've sent teams down there from HHS to assist with testing. I know that California has a very good plan. I know that we're working with Arizona, and they have a pretty good plan. Texas has actually sent testing kits that we've given down to the border, 40,000 of them. So there's testing happening. What we're seeing is less than 6% positive right now coming across the border. The next step.
That was what I wanted to know. So it's less than 6%. I appreciate that, and I have to tell you, I think the stay in Mexico policy needs to be reinstituted so that we can do this in a humane and positive way, help these folks. And with that, Madam Chair, I yield back.
Thank you.
I think my time is up.
Ms. Underwood. Ms. Hanson.
Thank you, Madam Chair, and thank you again, Mr. Fenton. So I just wanted to go back to something actually that Congresswoman Underwood mentioned earlier about the vaccine distribution site in Chicago. We heard about that and some challenges facing some of the big sites even, but ultimately, when it comes to a state like Iowa, big sites aren't really accessible to millions of Americans living in rural communities. And so I guess my question would be specifically, what is FEMA doing to ensure that rural Americans, like my constituents in Iowa, are given that same level of access and support by FEMA as folks in big cities?
Yeah, no, I appreciate that question. And so across the country and in places like Iowa and other rural areas, we're providing support to over 700 sites since January 20th. The $4.42 billion we provided to state and local governments to help create capacity and support, whether it's contracts, mutual aid, their own forces to vaccinate is what we've done. But I think it's bigger than just the vaccine supply going to the state. It's using the pharmacies. It's using also other capabilities through going direct to skilled nursing facilities and long-term care facilities to vaccinate those most at risk. So we're doing that everywhere across the United States. In 18 locations, we targeted these large population cities because we've seen such high COVID among different groups and wanted to focus on those with these 18 sites. We'll continue to expand that, but I am providing people, personnel, equipment, and supplies to all states, including Iowa.
Okay, so could you give some specific examples? You mentioned obviously pharmacies and getting down to that level. How are you really targeting down to that local level? Is it community leader based? Is it the local public health entities, local emergency management? How are you getting that granular, so to speak, on the local level with rural populations?
Yeah, it's communications. There's a national strategy, national communications that's going out, especially with regard to vaccine hesitancy right now, to urge individuals to get vaccinated. But we are supporting state and local plans. They know their communities best. They know the best way to reach them, to interact with them, where to vaccinate them. And we're really following that and providing them the right resources. And there's a bunch of different federal agencies doing that. So if it's a rural area and it's a small area, it may be using a mobile capability to go there and maybe set up a one-day site. We have mobile capability. VA has mobile capability. And there's other federal agencies that have mobile capability. So lending that capability with people that can vaccinate to the state may be one solution. They may have mobile capability that we're funding. And so everything's on the table. This is our biggest priority. When they tell us what their plan is, what their strategy is, we're supporting that with either people, funding, equipment, or supplies.
So for a mobile aspect, for example, so for a state like Iowa, you get an additional vaccine allotment for the mobile distribution, or would it be included in the state vaccine distribution?
It's in the state vaccine distribution, so there's no additional for the mobile. The only additional vaccine we provided was the pilot 18 sites that have been turned on so far, but there's no additional vaccine. But the pharmacy is additional vaccine, so the vaccine going directly to pharmacies, the over 2 million to 10,000 pharmacies across the United States is an addition. And then there is vaccine going to VA, so if there's a VA location in your state that's vaccinating veterans, that's in addition to. And then there may be other federal agencies vaccinating federal employees within your state. And so that would be in addition to the state allocation.
All right. Thank you, Mr. Fenton. And Madam Chair, I yield back.
Okay. It's now time for our next panel. Administrator Fenton, thank you again for your time. And please stay in touch with us and our staff about how we can be helpful in your efforts to respond to COVID and other emergencies and disasters. And again, please extend our most sincere gratitude to your colleagues across the country. We will now recess to prepare for our next panel and we'll return shortly. We will now go to the second hearing panel, which includes Mark Gallanducci, the Director of the California Governor's Office of Emergency Services, Curtis Brown, the State Coordinator for the Virginia Department of Emergency Management, and also the co-founder of the Institute for Diversity and Inclusion in Emergency Management. Patrick C. Sheehan, the Director of Tennessee Emergency Management Agency, and Kevin McGowan, the Director of the Los Angeles County Office of Emergency Management. Gentlemen, we will submit the full text of your official statements for the hearing record, and I would ask you each to keep your oral testimony to 5 minutes. Director Gallanducci, let's begin with you.
Impacted California. As of March 11th, the state had a cumulative total of over 3.5 million cases and over 54,800 COVID-related deaths. Essential workers risked their lives to keep our vital systems working while the majority of the population were confined to their homes. Government and businesses in California fundamentally changed the way they had to operate. This change extended to emergency management. The cascading impacts of this virus forced us to pivot, to reevaluate standards, operating procedures, and to address shortages in life-saving commodities and resources, and to implement plans to respond to later surges, all the while managing concurrent disasters that we were facing. Since the beginning of the pandemic, CalOES has led the state's response in coordination with our Health and Human Services Agency, our Department of Public Health, many other state agencies, local governments and departments, and our great partners at FEMA. This collaboration ensured for the state's response efforts to remain centralized and unified through the State Operations Center. By applying our well-established emergency response framework and adapting it to fit the pandemic, California effected tremendous progress in flattening the curve and limiting the spread of the virus. However, we faced unprecedented challenges while also enduring multiple multifaceted, multi-incident, all-hazard disaster response operations amid the pandemic. Additionally, COVID-19 further worsened equity gaps and disproportionately affected individuals. These extraordinary challenges and new disasters led to unparalleled strategies focused on achieving the equitable distribution of information, resources, commodities, and vaccine administration. While facing these challenges, California worked in close partnership with FEMA to develop and implement a multitude of innovative public assistance programs in the area of PPE, emergency feeding, emergency housing, alternate care sites, and medical surge capability, testing, mega vaccination sites, and mobile vaccination clinics. In fact, California was the first in the nation to develop and implement specific programs in partnership with FEMA to assist impacted populations, such as the Great Plates Delivered program, which provides prepared meals through participating restaurants for adults 65 and older and adults 60 to 64 who are at high risk and unable to prepare meals or access food resources while staying at home. In addition, this program also supported local restaurants, other food providers, agricultural workers, and food service providers who have closed or are struggling to remain open during the COVID-19. Project Room Key, which provides safe isolation capacity for tens of thousands of Californians experiencing homelessness. Housing for the Harvest, which provides temporary emergency non-congregate shelters for agriculture and field workers and have played an essential role in enduring the continuity of our food supply. Project Hope, which provides isolation and quarantine housing for recently released inmates on parole or probation. And Hotel for Healthcare Workers, which kept California healthcare workers and other public personnel safe and healthy by providing free or discounted hotel rooms for those working to care for COVID patients, reducing the risk of them bringing the virus home to their families. And lastly, Hospital Training Academy, serving the community, which used FEMA dollars in conjunction with the Unite Here Local 11 and LA County and LA City to provide meals prepared in industrial kitchens to homebound seniors and others affected in the pandemic. Lastly, our most recently, and as of February 16th, in partnership with FEMA, California stood up 2 first in the nation pilot mass vaccination sites, part of President Biden's 100 site across the nation. Focusing on underserved, high COVID risk populations, these 2 sites were established in Oakland and East Los Angeles. In addition to these 2 fixed sites, and with a focus on equity, each site working with community-based organizations, faith-based organizations, and community leaders, also deployed 3 mobile vaccination clinics to penetrate into and better serve the community. To date, over 350,000 vaccinations have been delivered through these 2 mega sites, with a metric representing over 60% people of color or underserved. As the state, as the state of this pandemic continues to evolve, so do our efforts and partnerships with FEMA and under leadership of Bob Fenton, both here as the regional administrator and now as the acting FEMA administrator, which has been just an incredible amount of leadership and partnership to help mitigate its effects, to ensure that all Californians have the resources needed to fight this pandemic. Thank you for the opportunity to testify before you today, and thank you for your commitment to ensure for strong preparedness and response to this pandemic. We'll look forward to answering any of your questions.
State Coordinator Brown.
Good morning, and thank you, Madam Chairwoman and Ranking Member and members of the subcommittee. As the State Coordinator of Emergency Management at the Virginia Department of Emergency Management and co-founder of the Institute for Diversity and Inclusion in Emergency Management, I appreciate the opportunity to discuss the role of FEMA and emergency management community and the ongoing response to COVID-19, including opportunities to address the disproportionate impact of disasters on marginalized and frontline communities. As we've recently passed the 1-year mark in this historically long response, we pause to recognize those who have been lost from this disaster. We also recognize the hard work and the resilience of frontline essential workers, nurses, doctors, public health and public safety community, including emergency managers, who have been courageously responding to this disaster. Those who have been lost serve as our motivation to improve our response in real time and in preparation for future disasters. In emergency management, we try to learn lessons in order to improve for the next disaster. Due to this long event, it's important that we not wait until the end of this response, but have critical conversations and evaluations now. 3,000 lives were lost during the tragic 9/11 terrorist attacks, over 1,800 deaths during Hurricane Katrina, and close to 4,000 deaths during the 2017 hurricane season. All led to major legislation, new policies, changes, and additional resources to support emergency management. The historic impact of COVID-19 pandemic has resulted in over 500,000 American deaths, including 10,000 Virginians, which requires us to commit to taking bold and innovative action to vastly improve our performance for the next pandemic and disasters. It is important to note that on top of the response to COVID-19, FEMA, state and local emergency management has also responded to numerous other events over the last year, including major flooding, ice storms, protests, hurricanes, which have stretched resources. So how do we learn from this catastrophic event and move forward? We have seen once again the disproportionate impact of COVID-19 on communities of color, people with disabilities, and marginalized communities, which require the urgent integration of equity into emergency management. This event has also demonstrated the important role of FEMA and emergency management as a profession for coordinating responses to disasters. Leveraging emergency management's all hazards expertise in logistics, coordination, and capacity building is needed to move with speed to ensure a whole of government response. Early in this response, FEMA was not fully leveraged and empowered to do that. It hurt our response and negatively impacted us working on the state level. Improving our coordinated response to disasters will require streamlined processes, eliminating complexities, prioritizing equity to support communities most at risk, and increasing and diversifying staffing. We also need to build emergency management capacity at the state and local level, recognizing the new normal, more frequent and impactful disasters, and the growing impacts of climate change. Despite the challenges of this response and issues to address moving forward, I am hopeful due to recent actions of Congress and the Biden administration to support states and our communities. New tools and resources provided by Congress and President Biden is enabling us to move forward with our Vaccinate Virginia campaign while continuing to test, contact trace, get our schools open, and support vulnerable Virginians. We are working closely with FEMA to leverage funding and other resources to equitably open community vaccination centers in our hardest hit communities. I'm appreciative for Congress passing and President Biden for signing the American Rescue Plan, which includes numerous support for emergency management, including $100 million for the Emergency Management Performance Grant Program. Having strong leadership at FEMA is essential to ensuring the agency moves forward. That is why I look forward to working with Administrator nominee Deanna Criswell to further resilience building and address these issues. Administrator Criswell is a top-notch and well-respected emergency manager who will bring the wealth of knowledge and experience to the position. And appreciate the leadership of Interim Administrator Mr. Fenton. In closing, thank you, Madam Chairwoman, for convening this important hearing and providing an opportunity for emergency managers to offer recommendations. I'm happy to answer any questions from the subcommittee. Thank you.
Next, we will go to Director Sheehan.
Thank you. Good morning, Chairwoman Roybal-Allard and Ranking Member Fleischman, distinguished members of the committee. My name is Patrick Sheehan. I am the Director of the Tennessee Emergency Management Agency. I'm grateful for the invitation and this opportunity to speak with you today. First, I want to acknowledge the loss of more than 11,000 Tennesseans and 530,000 Americans to this virus. Our hearts join in mourning the too soon loss of life of so many Tennesseans and Americans, and nearly all of us have experienced the loss of a friend or loved one, and our hearts ache with our fellow Americans at that loss. Second, I want to express my sincere gratitude for my teammates, for the Tennessee Department of Health, medical personnel across Tennessee and across our nation for the dedicated work they've continued to do for more than a year now. I want to express my gratitude for our local responders, our local emergency managers, the Tennessee National Guard, for FEMA and emergency managers everywhere for the work that they have continued to do in these challenging times. This pandemic has challenged these heroes in ways that few expected. And time again over the last year, they've stepped up and served. It's awe-inspiring to see the commitment of our public health partners and our agencies to serve their neighbors, and humbling to work shoulder to shoulder with them. In Tennessee in 2020, we've been tested over and over again. Starting in January of 2020, the Tennessee Department of Health, the Tennessee Emergency Management Agency, and the governor's office, a number of other departments convened to examine the situation that was developing in China and the reports that started coming in from Europe on the spread of a novel coronavirus. We used that opportunity to examine our plans, protocols, and to try to prepare for the road that was ahead of us. Shortly after we began convening those, we were struck on March 3rd by a series of deadly tornadoes, the largest of which had a 60-mile track, and it hit Nashville and tracked almost due east, taking 25 lives and destroying hundreds of homes and damaged millions of dollars worth of infrastructure. And Tennessee is the nighttime tornado capital of the United States. We have more nighttime tornadoes than any other state in the Union, and unfortunately, nighttime are also the deadliest. I'm incredibly grateful for the quick work of FEMA following that disaster. I'm also incredibly grateful for the work of our county emergency managers and partners. What I think we showed is that the investment over the last 5 years that we've made in working together and collaborating and building a collaborative emergency management enterprise in Tennessee paid dividends. We had, while that disaster, the tornado, was widespread and sudden and struck in the middle of the night, what we found that our system worked collaboratively. We had good communication and very few. It was also heartwarming to see the outpouring of the volunteer spirit, Tennessee being the volunteer state, as thousands of Tennesseans and neighbors from other states poured in to help the immediate response and recovery from that disaster. Then on March 5th, Tennessee had its first confirmed COVID case. A physician who had attended a conference in Massachusetts was confirmed by our superb Tennessee Department of Public Health Lab as being the first COVID case in the state of Tennessee, the first of more than 660,000 cases that we would have here. Tennessee's also conducted more than 7 million COVID tests since that time. On April 12th and 13th, then another series of storms and tornadoes hit the eastern Grand Division of Tennessee, and that disaster, coupled then with the derecho in Waco in May, and then a Christmas bombing, just has brought a lot of destruction to Tennessee. Policies, FEMA has done some things incredibly well. Emergency managers have really pulled together to help address our needs. Tennessee's vaccination plan has been lauded for choosing equity and buying down risk as quickly as possible. And I will just flag, too, that equitable distribution of vaccine or aid takes time and patience and persistence. And for a myriad of reasons, from access to lack of transportation to lack of trust in government programs, if we're going to have equitable allocation of vaccine, it's going to take us being patient and persistent and working with communities that are most at risk. If we're going to continue to have data-informed, risk-based allocation of vaccine, in some ways we're going to have to be patient. We have to make vaccine available, but in Tennessee's model, we've held out an allocation specifically to ensure that we don't leave out communities that have been most impacted. And as my colleague Curtis Brown has indicated, we know that the African American community has disproportionately been impacted by the COVID-19 pandemic, both in terms of cases, hospitalizations, and death. And we're able to see that and act on it. And I would encourage whatever we do with vaccinations moving forward, that we continue to be patient in ways that are meaningful. I just want to thank you again for the opportunity to be here and to talk a little bit about what challenges Tennessee's faced. I look forward to answering any questions that you might have. Thank you, ma'am.
Thank you. And last, but certainly not least, Director McGowan, please begin your testimony.
Good morning, Chairwoman Roybal Allard. It's nice to see you. Last time we were together here in the Emergency Operations Center, Ranking Member Fleischman and honorable members of the subcommittee. My name is Kevin McGowan, and I serve as the Director for Los Angeles County's Office of Emergency Management. Thanks for this opportunity to discuss the county's response to COVID-19 and our partnership with FEMA. First, I'd like to acknowledge the incredible toll that COVID-19 has taken across our county and throughout the country and throughout the world. In Los Angeles County alone, COVID-19 has caused more than 22,000 deaths and infected over 1.2 million people. I also want to extend my deepest thanks and appreciation to the hundreds of thousands of Los Angeles County healthcare workers, emergency responders, disaster service workers for their commitment and steadfast resolve in day out answering the call to service. They truly represent the full measure of public service. By virtue of our size, Los Angeles County faces numerous challenges during natural disasters, human-caused disasters, and technological disasters. In 2020's National Risk Index, FEMA identified Los Angeles County as having the highest risk index of all other counties in the country. This underscores the critical importance of Los Angeles County to continue to build our emergency management capabilities and mitigate the natural risks of natural disasters, and similarly address our response to disasters like the COVID-19 pandemic. On March 4th, 2020, Los Angeles County proclaimed a local emergency due to COVID-19. The county's Emergency Operations Center immediately activated, and from day one, our initial emergency management actions were to coordinate and support the county's public health efforts in mitigating the effects of this global pandemic. The subsequent activities resulted in uninterrupted continuation of our county's essential services, while also allowing for the distribution of tens of millions of critical pieces of personal protective equipment, the administration of millions of COVID-19 tests, millions of doses of vaccination, the distribution of millions of meals and other essential goods to our communities, the safe sheltering of thousands of individuals to prevent the spread of COVID-19, and the local financial and programmatic management of hundreds of millions of dollars in FEMA's public assistance program. Unity of effort with our federal, state, and community partners has been the cornerstone of our response. In Los Angeles County, it's truly been a whole community response. The county's emergency management mission requires this, and it is ever present in our strong organizational partnerships with FEMA and the California Governor's Office of Emergency Services, and my personal professional relationship with Mr. Fenton and Mr. Ghilarducci. No one governmental organization can do this job alone. With this whole community partnership, we've leveraged our strengths, capabilities, and resources to respond to this pandemic. There have been numerous positive results from this partnership. The first was FEMA's rapid approval of expedited projects, which provided a lifeline of critical financial resources to the county and supported our ability to continue to provide these critical services and response functions to our community. The second was FEMA's support for non-congregate sheltering, which resulted in Project Roomkey, a collaborative effort with the state, the county, and the Los Angeles Homeless Services Authority to secure hotel and motel rooms for vulnerable people experiencing homelessness in our county. Project Roomkey not only helps protect high-risk individuals, but also helps prevent the spread of the virus in our communities and has the added value of bringing capacity and protecting our hospitals and healthcare system. The third, FEMA's efforts to support the distribution of vaccines to residents from communities have been disproportionately impacted by the pandemic. FEMA's partnership with Cal OES and the California State University of Los Angeles has resulted in the administration of hundreds of thousands of vaccination doses in some of our county's hardest hit communities. And I'll reference Bob's earlier comment about that hub and spoke model where the Cal State LA site serves as the hub, but then we have mobile sites that spoke off of that. Finally, I want to express the county's appreciation and support for President Biden's executive actions in January 2021, directing FEMA to provide 100% reimbursement of eligible costs for public assistance programs retroactively to the start of the emergency, as well as prospectively. This action greatly reduces the financial stress of the widespread pandemic-related costs, which have been borne significantly by local jurisdictions, including Los Angeles County. The pandemic is not over, and we understand there's a long road ahead. We appreciate our partnership with FEMA and hope to continue to identify ways to improve effectiveness and efficiencies in our response and recovery efforts. In particular, I recommend exploring more integration with FEMA response capabilities at the state and local organizational level, streamlining the administration of public assistance programs, including the minimizing of administrative burdens on local jurisdictions. And then 3, revising grant methodologies and requirements for performance periods for grant programs like the Emergency Management Performance Grant and the Building Resilient Infrastructure and Communities Grant. And all of those under the consideration of the new National Risk Index, which shows that Los Angeles County has a significant path ahead. Additionally, the county is hopeful that an additional upfront commitment from federal financial resources can be attained to continue our important initiatives that we've already invested in and underway. Thank you so much for this opportunity to appear before this subcommittee, and I look forward to any questions you may have.
Director Ghilarducci, I understand that during the pandemic, the state of California worked with FEMA, local governments, and the restaurant industry to develop a program called Great Plates, which has also been adopted elsewhere in the country. Can you explain what Great Plates is, how it has worked, and if you believe it is a model for providing food assistance during and after other kinds of disasters?
Thank you, Congresswoman. So Great Plates was an idea launched in April of 2020. It's a program that aims to provide meals, again, to adults 65 and older and adults 60 to 64 who are at high risk, designated by CDC guidelines, and who are eligible to assess free meals while staying at home or ineligible for other nutrition programs. The program also supports local restaurants and other food providers and agricultural workers who have closed or are struggling to remain open during the COVID-19 pandemic. To date, the program has served over 28 million meals to older Californians since the program's launched in April. Using the emergency feeding program framework approved by FEMA, OES, in partnership with our California Health and Human Services, work directly with local governments to implement the program. The program is locally led with a designated local government leader responsible for program administration and operations, including all fiscal data requirements, reporting, participant food provider enrollment, and delivery services. OES provides technical assistance, engages directly to make sure that the program runs smoothly, provides any additional clarification or resources to make the program supportive, and has a website, covid19.ca.gov, which allows local governments to participate in the program. Overall, the program has been very, very successful, obviously with the number of meals that have been served. It really is a model for providing food assistance that work well for populations seeking this particular circumstances in the pandemic, but does, we believe, have merit in other kinds of disasters where we have communities that have been impacted, mobility has been decreased, and the ability for people who have limited either its access and functional needs, or their seniors have the inability to get out and be able to get the assistance that they need. So we believe that as time goes on, Congresswoman, this is a program that can be a model in the emergency management and be utilized across the country.
Can you elaborate on some of the other innovative programs that California has developed in response to the pandemic?
Sure. So some of the other interesting programs, obviously this Project Room Key, which was the ability to identify hotel rooms, working with the hotel industry. And the idea was to provide safe isolation capacity for tens of thousands of Californians experiencing homelessness. This was an idea to get homeless people who are homeless off the streets, out of congregate shelters, into safe and secure hotel rooms where they can be monitored and supported, both with meals, with testing, with contact tracing, and keep them as safe as possible. That program has been working very well and been very, very successful. As well, housing, a very similar program, Housing for the Harvest, which provides temporary non-congregate shelter for agriculture and farm workers. And as you know, many of our farm worker communities within the state, these are migrant farm workers, they come in, their general culture is to congregate as a family. We were seeing a high degree of COVID spread in these family congregation units. And so we had to work with them to be able to establish these housing opportunities, again, much like a hoteling program, and be able to get them to uptake. And we saw then, we started a drop in the number of cases that we saw in the spread. And so again, the Housing for the Harvest, we used in the Central Valley, hard-hit Central Valley, hard-hit Imperial Valley, along the Monterey coastline, down in Ventura County. These were all areas where we see a lot of our agricultural industry, and the program proved relatively successful for that. Those are a couple of different key programs that we implemented that had a great uptake and were very successful.
Mr. Fleischman.
Thank you, Madam Chair, and to all the witnesses. I appreciate your participating and your patience being in the second panel. Madam Chair, I want to specifically welcome Mr. Patrick Sheehan. This gentleman I've worked with extensively in the great state of Tennessee in his capacity, and we've been through disasters together, but he and I have both worked very well with FEMA, so it's great to have Patrick and all of our guests with us. And I'm going to, in the interest of time, move forward with my first question. I'll direct it to Mr. Sheehan first, but I am solicitous of all of the other witnesses to get their thoughts as well, to get varying perspectives. Last year, the governor's office contacted me about FEMA and was proposing, these were changes that were proposed regarding reimbursement for PPE in terms of classifying PPE as increased operating costs or emergency protective measures. This change in classification could have huge impacts on state budgets, with damaging public health results. My question is in two parts. Have you run into challenges with inconsistent classifications? And secondly, what would be the budgetary impact of absorbing increased operating costs into your state and local budgets?
Thanks, Congressman, for the question. So from 21 January 2021 moving forward, the kinds of actions that we took to provide PPE and sanitizing materials to schools is considered eligible. But those actions that we took in Tennessee to help provide PPE and sanitizing materials, cleansing materials, cleaning goods to classrooms so that we could have safe reopening of schools last year. So the actions in Tennessee that we undertook in July and August, those were considered or determined to be increased operating costs as opposed to an emergency protective measure. I disagree with that estimation or the way that was determined. I think if FEMA now says that those are indeed emergency protective measures, that those should be consistently classified as emergency protective measures. We undertook those actions then not as an increased operating cost, but as a way to safeguard the well-being of teachers and students and faculty and staff in schools.
Thank you. Who would like to jump in and participate further? I'll open it up.
Congressman Curtis Brown from Virginia. I agree with Director Sheehan. These are protective measures and life safety goods for our citizens and essential workers. And as I stated in my written testimony, having all the tools, including the full support of the federal government in terms of providing these funding and 100% reimbursement is essential for our ability to respond. And so providing us on the state and local level with that funding frees up other resources to support other essential government functions that are outside of the emergency declaration.
Thank you, sir. Would anyone else care to respond?
Congressman, this is Mark Ilarducci in California. Just first of all, let me just say, we've been absolutely so appreciative of our FEMA partners, and they have been right with us in being able to try to find innovative ways to be able to cover the cost of all of these things. I think early on in the pandemic, we all believe that the items that were brought up by my colleagues from Virginia and Tennessee are eligible emergency protective measures. And they are things that, whether it's PPE or ventilators, was a lot of requirement upon the states to have to go out and procure much of this equipment. At the time, the federal government wasn't providing the resources. The Strategic National Stockpile was not operating efficiently or effectively. We weren't getting the resources that were needed. So it's really incumbent upon the states to go out and procure this equipment. For schools, for opening schools, for keeping teachers safe, to making sure that our transportation workers or our frontline workers have the PPE where necessary. These are all things that really would be something that needed to be eligible under emergency protective measures. And even if we hadn't used all of the PPE at the time we needed it, you don't know that as well as the number of surges that were going to be reoccurring. Now we are, most of the states are in a place where we have resources in our warehouse. We're ready to deal with a surge and be prepared for that. And again, these are all things that have a direct nexus and correlation to the response to COVID and really should be a reimbursable item.
Thank you, sir. And with that, I will yield back.
Mr. Rutherford.
Thank you, Madam Chair. Gentlemen, as a first responder myself for many years, and kind of enjoying the federalist ideology that the individual states and localities control their own destiny. That's one of the areas that I think is most interesting in this pandemic. And the reason I say that, I know in Florida, and maybe it's because of our familiarity with emergency management as a result of hurricanes coming through every year, which is never fun, but also the development of the National Incident Management System. I don't believe there's any agency, local, state, within Florida that's not NIMS compliant at the highest levels. And so my question is this: one of the challenges that I see with COVID-19 was the fact that, you know, normally when you have a disaster, you get resources that come in from outside your state to assist. That clearly didn't happen here because the disaster was in fact nationwide. So and I know states like Mr. Brown, you mentioned Vest, and they're in Virginia. How much more difficulty was created by, number one, the fact that assistance couldn't come from outside the state, except at the national level? And then the issue of dealing with a pandemic and lockdown and your own people, you know, being impacted by this. And having to do everything sort of virtually, I guess. Can you talk a little bit about your experience with that?
Thank you, Congressman. Yes, it's very difficult within this mostly virtual environment. We want to follow health and safety protocols. Within emergency management, through the National Emergency Management Association, we have our Emergency Management Assistance Compact that we leverage each other when we have a tornado or a hurricane to send staff to support. Clearly, that capability was limited because everyone was dealing with their emergency at home. And so we've tried to scale up resources here within the state through our Department of Health, working with our Medical Reserve Corps to leverage retired medical professionals, doctors and nurses. We've definitely leveraged the funding from the federal government to leverage contractors and pull in all of our state agencies as well. Right now, for our Vaccinate Virginia campaign, we have a goal of 1,000 state employees to support at our vaccination centers, et cetera. So it has been a very difficult response environment, but we've been very creative. We also appreciate the support of the private sector who have changed their operations. We had a couple of places that used to make beer and wine, change their operations to make hand sanitizer and masks and things of that sort. So we've been able to innovate and create at real time. Also recognize the faith-based community, our nonprofit organizations who are most directly connected to our communities of color and marginalized communities. And so it's really been an all hands on deck response given the scale and the impact of the disaster.
Thank you, Mr. Brown. Mr. McGowan, the response, what singular, well, I don't want to say singular because I'm sure there's many. What's the most important change going forward for emergency management on a statewide level are you dealing with now?
Thank you, Congressman, for the question. So I think, COVID-19 has provided this evolution of response phases. And, in Los Angeles County, we've endured multiple other incidents that have occurred while COVID-19 pandemic response has occurred. And one thing I think that's highlighted for us is our ability to continue to build out capabilities and capacity with the use of in the state of California, we have disaster service workers, which empower local governments and then also the state government to, have county or city municipal employees be tasked to do work towards disasters. and really leverage all of these things and learn from those lessons so that we can apply them to future disasters such as an earthquake, and really see what our true exposure risk is. And then all the while, be creative, like Mr. Brown has said, Mr. Ghilarducci, Mr. Sheehan, about leveraging new things that we've never leveraged before, partnerships with the private sector. I think the story is probably consistent across the entire country about partnerships with creating hand sanitizer and masks. One thing that I think has been very unique about this is we've strained every resource. Every resource has been scarce across the country because everyone needed it, whether it was personal protective equipment, hand sanitizer, sanitation equipment. And so to really be creative at the local level to figure out how to solve those problems was a good lesson learned.
Right, and we can't depend on China to supply what we need either. Well, I see my time's running out, Madam Chair. I yield back.
Thank you very much. I have several questions that I would like to ask. I see that we are running out of time, but I'd like at least to ask the following questions for the whole panel. What lessons have you all learned from this pandemic and that will assist you in responding to future disasters? And if we could just start with Ghilarducci and then go on down the line with Coordinator Brown, Sheehan, and then Gowan.
Congresswoman. So I think beyond anything, I think that this particular event really amplifies the whole issue about coordination and relationship building, the ability to work together at a time when resources are stretched thin. We've learned that we need capacity within this country. There should be no reason, none in the United States of America, that state and local emergency managers and the federal government are straining for resources of this style, of this type, when we have such a critical crisis on our hands. The whole issue of information, misinformation, the ability to make sure that we are all rowing in the same direction through a communications plan that is adopted at the local, state, and federal level. These are people's lives we're talking about, and we were very disjointed. We had commodities that were old or not operational. And we talked about this, the Congressman member talked about NIMS and the National Incident Management System. I couldn't be more relieved when FEMA came on the scene to help to coordinate USHHS. That's an organization that had a big role here, but they don't know ICS. They don't understand the role of how to implement and what's going on the ground. And it's a very much top-down organization. If you don't have good situational awareness on the ground, you're never going to know what really your needs are going to be, and you're going to be late to need. So these are just real key lessons learned. I would just close by saying the Stafford Act needs to maybe be relooked at and maybe broadened to address the issues of pandemic. I think there was a lot of workarounds and the ability to try to stretch the Stafford Act in a big way. But when you look at other agencies and what they can bring to the table, if they were less, I would just say, bureaucratic and more thinking about what the immediate need is, they may be able to have under their own authorities the ability to leverage resources in a much more expedited fashion. And then of course, giving us an expedited cost recovery, which will help local governments and particularly stay afloat when we're dealing with this long-term kind of year-long disaster where we need those funds immediately. Those are just some of the things, Madam Chair.
Okay, Mr. Brown?
Thank you, Madam Chairwoman. I second everything that Director Ghilarducci just mentioned. I will probably highlight the importance of equity and disproportionate impacts in disasters. Time and time again, with every disaster, we see that the folks who suffer the most are communities of color, marginalized communities, people with disabilities, who again suffer whether it's a flood or hurricane or natural disaster. So how do we change our programs and policies to prioritize them and to build resilience ahead of time and to work with speed to mitigate the loss of life and those negative impacts? Equity has been a core part of our response here in Virginia. We have a health equity working working group and a task force is a part of our unified command that really guides our resource allocation, our planning, our prioritization, working with FEMA and the funding provided by Congress for our community vaccination centers. We've used a strategic approach to identify those areas that are most vulnerable and that have been hardest hit by COVID-19, large number of vulnerable populations and impoverished communities. I'm here in Danville, Virginia, and in Southside Virginia, where our first CVC opened up yesterday, and very appreciative from the community. We're vaccinating those who are most at risk and vulnerable, our seniors, communities of color, and equity is guiding our whole response. And so as we move forward, looking at FEMA policies, the Stafford Act, programs, grant programs like the BRIC program, I think equity needs to guide what we do. It's going to take a lot of work and intentional action, but if we're able to be successful for future disasters, we'll protect those who need the most support and those who are most at risk. Thank you.
Director Sheehan?
Thank you, Chairwoman. I think the first thing, and it kind of touches on the supply chain issue, and it's included in my remarks, but our domestic manufacturing capability needs to be reevaluated, and perhaps along the lines of the defense industrial base, where we examine what kind of capacities we need here domestically to ensure the safety and well-being of all Americans. More centered towards emergency management, I think we can build some more policy and program predictability and consistency, both just across the disaster management programs within FEMA and across regions. My counterparts and I often talk about how FEMA policies are applied or interpreted differently from region to region. I think I echo what Director Gillajucci said. The Stafford Act really needs a comprehensive review and probably an overhaul. It's 35 years old, I think, at this point, almost 35 years old, and it's just time for, we've learned a lot about emergency management in the last 35 years, and we really need a peacetime look at this, where we're not being forced by just some event to fix certain parts of it, but really comprehensively, disaster management and emergency management in the United States needs comprehensive overhaul. The last thing I'll just say is, and this is something that I try to share with my team pretty often, is that if something can happen, it's going to happen. If something has happened, it will happen again. And we're going to have additional pandemics in the future. We're going to continue to have disasters while we're facing public health crises. And we need to face these crises, face these disasters with that lens. Because our memories as human beings are very short when it comes to disastrous events, and emergency managers, whether at FEMA, for the state of Tennessee, at a county level, we need to take a long, holistic view about what we can do to buy down our risks and make our nation more resilient, make our communities more resilient, and we just got to keep that in mind. Thank you, ma'am.
Director McGowan?
This is the beauty of going last, so I echo everything that everyone said. I'll keep my marks really quick. An ounce of prevention's worth a pound of cure, so my grandma always used to tell me, and I think it's the investment on the front side. So building off of what everyone else said, but adding to it, the BRIC program, we've seen the pandemic do what most of the other catastrophic disasters have done, which is they exacerbate the already pre-existing issues within society. So whether it's health equity, a variety of other types of things, food insecurity, to name a few, we should be investing in those. So I know we've talked a lot about emergency management, but a big part of this pandemic has been just the structural and systematic or system-wide challenges that we face, and the pandemic has exacerbated those problems, and an earthquake's going to do the same thing, wildfires do the same thing. So to continue to invest resources in programs like the BRIC program is going to be critical to make sure that in future disasters, the society and systems that support society are resilient and robust enough to weather through those storms.
I have another question dealing with the emergency management performance grants. Both the CARES Act and the American Rescue Plan Act of 2021 provide funds for the Emergency Management Performance Grant Program. Can you tell us how EMPG has been of assistance during the pandemic and how your state and its communities have used EMPG? And this again is a question for the entire panel, but I can start with you, Mr. McGowan, since you've been last all the time.
Okay.
First.
Yes. So I'll start off actually with a way that we can improve EMPG, which is I think the Emergency Management Performance Grant has some administrative burdens and timelines associated with it that don't make it the most effective grant at leveraging towards what I call like the big problems. So a lot of programs I think use the Emergency Performance Grant to tackle things that are kind of low-hanging fruit. So in general, most of our emergency management performance grants are geared towards purchasing or a maintenance of effort or critical supplies within our emergency operations centers, for example. We also use them to develop critical plans like our emergency operations plans. And then sometimes, you know, organizations, including Los Angeles County, use them to for critical staffing positions. So there's these different kind of buckets that the Emergency Management Performance Grant goes towards. But I think it would be a much more effective grant if we could leverage it over a longer period of time with kind of some less restrictions or less administrative burdens on it, that then we could really target it towards really more substantial challenges. So with that, I'll hand it over to the rest of the group.
Okay, I'm going in reverse order this time. Director Sheehan.
Thank you, Chairwoman. I think Mr. McGowan was touching on this, but you know, in some ways, the EMPG has also become a little more complex. They've added some administrative burdens to it that's made it more difficult. But that being said, EMPG is the primary preparedness funding mechanism for emergency management in the United States of America. Yet we find that no matter who's president, that program is on the chopping block, or it faces reductions that have to be that Congress, regardless again of party, ends up restoring the full amount which is needed. We rely on EMPG at the county level. We rely on the state level, and it builds the capacities that we use to manage disasters. When Tennessee sends first responders via the Emergency Management Assistance Compact to Florida or the Virgin Islands or to Puerto Rico or to the Carolinas, a lot of those capabilities have been funded and bolstered by the Emergency Management Performance Grant Program. And it really needs stability and predictability. And I think Mr. McGowan also talked about just the need for a longer time horizon, and I certainly agree with that. We have opportunities here, I think, to bolster these capabilities over time, but they take time and they take predictability so that we can budget for them. Thank you.
Mr. Brown?
Thank you, Madam Chairwoman, and I agree with my colleagues. EMPG is essential to our ability to respond and build capacity on the state and local level. We do need to eliminate any complexities with that, and also look at, again, what does emergency management look like in the 21st century, and look at additional funding and resources to support building capacity on the local and state level. Last year, we were dealing with 3 simultaneous statewide disasters, including COVID-19. We dealt with our busiest hurricane season. And so we're looking strategically at how can we build capability on the local level. There are a couple of my local emergency managers who are one-person or part-time staff. They are supported through EMPG, but building that capability so they're able to manage the full responsibilities of preparedness, mitigation, response, and recovery, given the impacts of climate change and more frequent and impactful disasters is going to be important. So I hope that we could collectively, as a profession, along with Congress and administration, look at how to recognize the innovation and the advances in the more frequent disasters and ensure we have the resources needed to face these challenges that we're facing today. Thank you.
Director Ghilarducci.
Great. Well, Madam Chair, you have such exceptional emergency managers on this panel. They're really hitting it all on all cylinders. And I've said this before and publicly said this before. Look, EMPG is underfunded. When you think about the fact that we are seeing more complex by scope, by scale, by type of events, the diversity, the impact on our communities, the frequency of these kinds of events. You amplify that by climate change, by biohazards, by pandemics. The emergency management community needs to have resiliency. They need to have that resiliency built in, baked in. Emergency management performance grants across the country at 350 million or so is really nothing by comparison to what needs to be invested into that to help local and state emergency managers be able to build that capacity, that sustainability to deal with all hazards. As you've heard, multiple directors here today, including myself, we dealt with, as you know, Congresswoman, the worst wildfire season. We had civil unrest, we had an earthquake, we had the pandemic, we had power outages, all at the same time. And, that takes a lot of capacity training and ability to be able to navigate that and ultimately serve the public. So we're asking more of emergency management than we ever have in the history of our country. And I think that has to be reflected more importantly by the funding level first, but secondly, as stated, it has too many, it's still built on an old school format. It needs to be reevaluated and opened up and broadened to make most flexibility so that state and locals can utilize that in the most effective way possible.
And I have just one more question, and this is for you, Director, and Director McGowan. And this has to do with the issue in Los Angeles, which has been one of the cities that was impacted by the most impacted by the pandemic, particularly in my district of East Los Angeles, which has suffered, as you know, very high rates of infection and mortality rates. And yet rates are lagging there compared to other parts of the city and California as a whole. I know this has been touched on somewhat, but can you further address the challenges that you faced in assisting these communities and the steps that you are taking to address those challenges, particularly as they pertain to the vaccinations?
Kevin, you want to go first?
Yeah, I can go first. Thank you, Congresswoman, for the question. So health equity and the distribution of the vaccines in an equitable fashion has been a top priority. I think every Board of Supervisors meeting, we address this prioritization of effort. Our Department of Public Health, consistently is looking at the different metrics to evaluate the areas that are hardest impacted and then really work with the greater framework to make sure that we're pushing through the vaccination dosages in the areas that we can have the most impact in those heavily underserved and impacted areas. We have over 400 providers as a part of the LA County network that can distribute doses of vaccination. And then I also want to highlight the great partnership with Mark and Bob as it relates to the Cal OES and FEMA site that was set up at Cal State Los Angeles, and the just day-to-day support that goes into that site and reaching into our communities, our faith-based and community-based organizations to set up mobile vac sites. I think, Congresswoman, we're seeing the trend going in the right direction as far as getting vaccination in the areas that are most impacted. And every day every day I see marketed increases in those impacts. And the best, I think one thing we've observed over time, over the last month and 2 months of time, is that mobile vaccine sites, even though their capacity and throughput might be on a day-to-day total smaller than the mega sites, really gets to those communities in a more effective manner. So it's really a three-pronged strategy. We have to use big vaccination sites for big throughput and make sure that we can keep up with the supply that's being provided. we need to use our public-private partnerships with pharmacies and health clinics, FQHCs, our federally qualified health centers, and our hospitals. And then thirdly, we need to use these mobile vaccine sites to get to these impacted areas. And I'll close it out to say this. When we talk about vaccine hesitancy, one thing we've noticed when we've gone to a bunch of the mobile sites and we've talked with people going there is there's a really good word of mouth story that's being told now in these communities, and they really trust their community members more than they're going to trust the government public information officers putting out information. And we're seeing that snowball starting to occur where the community is talking with the community. They trust their community-based organizations and their faith-based organizations, and it's building the momentum in the right direction. And with that, I'll hand it over to Mark if he wants to add any.
No, he hit the nail on the head, and look at right from the beginning. As I said, it's all about relationships. So this has been a one team, one fight effort. Kevin at the county, the partners in the communities within LA County, FEMA and OES, our Health and Human Services Agency, all working together to try to address. Looking at the county as a whole. Identifying what we call vaccine deserts, areas where they're underserved and communities of color. Kevin was exactly right. The mega site, we chose Cal State LA and East Los Angeles strategically to address and put that mega site smack dab in the middle of the most underserved, parts of the county of Los Angeles. And but then it's those mobile clinics that sort of the hub and spoke where those mobile clinics have gone out in the community could not be successful without building relationships with faith-based leaders, community-based leaders, and the community leaders at large. It's taken a little bit to build the trust. There's a lot of misinformation, disinformation about the vaccines out there. But putting those mobile clinics in the right location. We now have mobile clinics stationed in South Central Los Angeles, in parts of East LA, outside of and around the mega site. And those sites have just we've really been able to penetrate. And Kevin's right. We're now at almost 70% of people of color and underserved being served by vaccine within the FEMA state site. Now, speaking about what we're controlling, and less than about 30% of non-people of color. This flipped. It was the other way around when we started, and it's a good trend. We're also, the governor, of course, has made a metric in place for all vaccines. The first have to be 40% underserved, and to meet that equity metric for all vaccines that are going to be pushed out by all counties in the state. And so from the state perspective as a whole, the leadership perspective of the governor, equity and making sure that the underserved, underprivileged, and people who have the hardest time getting the vaccine, but also been hugely impacted by the virus, are the ones that get the vaccine first, and that we take care of those folks. So, Congressman, it is continuing to be worked well, but it cannot be done, and it's one of those ones where you can't take your foot off the gas pedal. It has to be continue working with the community, because once you build the level of trust, you have to maintain that level of trust, and it is very, very critical that we continue to do that.
Right, absolutely. Okay. Well, as we've discussed, the past year has been challenging for our country and, in fact, for the entire world. But with infections declining and vaccinations increasing, there is light at the end of the tunnel. And I hope that we are never again faced with a pandemic of these proportions. If we are, I know we can count on FEMA and emergency managers at every level to help us see us through it. So I want to extend my sincere thanks to our witnesses for their testimony and for your service. And since there are no more questions, the Subcommittee on Homeland Security stands adjourned.